I am really excited for this episode because we're going to talk with someone who works at a specialty practice. It is not often here on Swaay.Health that we get a chance to speak with someone from a group practice and hear how they are using marketing tactics and techniques to acquire new patients and to improve their patient experience. Hello and welcome to Swaay.Health, where we bring you the latest insights and interesting stories from the brightest minds in healthcare marketing. I'm Colin Hung, and today I am joined by Ben Seals, the CEO of Thomas Eye Group in Atlanta, Georgia. He and I are going to talk about their interesting work and all the investments they've made to improve their patient acquisition and their overall patient experience. Let's get to it. Ben, welcome to the program.
Thank you so much. I'm glad to be here.
I'm excited to sit down with you because we don't get a lot of opportunities to speak to people who work at physician practices, and you're at a big one. So this will be fun to get your perspective on the topic at hand, which is patient experience this week.
Absolutely. Glad to share our thoughts.
So Ben, before we dive in, maybe for the benefit of our audience, can you give us a quick overview of who you are and Thomas Eye Group?
Absolutely. So my name is Ben Seals. I'm the CEO of Thomas Eye Group. Oftentimes I get called the marketing intern. I like to spend a lot of time in marketing. I'm a big fan of patient access, patient experience, but also patient acquisition or customer acquisition, market share acquisition. Thomas Eye Group itself is a large, growing ophthalmology and optometry practice. So we have 18 locations across Metro Atlanta, with a growing number of providers. I think last time we ran a census, it was 49 providers with a pipeline of 5 to 7 more that are going to join the practice over the course of this year. We serve everything from cradle to end of life eye care. So one of the greatest joys that I have is to be able to help doctors who go into the NICU and do eye screening services for premature babies. And at the same time, we're probably also taking care of that little baby's great grandparent and everybody in between. So we want to deliver a family lifetime of eye care experience, which means we need to be better at the patient experience or customer experience than anyone else in the market. Otherwise, we'll lose our patients.
I gotta, before we dive in, I gotta say, like, is it a very competitive market? I mean, it sounds like it really is very competitive for you.
Absolutely. Atlanta is a hyper-competitive eye care market. I think about 80% of the eye care providers in the state of Georgia live in Atlanta. A couple of my doctors bemoan the fact that they could stand on the roof of our flagship location and hit a golf ball to at least a dozen competitors in Atlanta. So there's a lot of competition in the eye care space, and whether it's on the retail, optometric, primary eye care side, or in the surgical, acute, tertiary care part of the eye care industry, there's a lot of competition in Metro Atlanta, and an evolving competition as well. We have every practice from hospital-based all the way to PE-based, and in between, you've got a few independents smattered in there trying to scratch out great patient care and great outcomes for the growing population of Atlanta.
Well, you're doing something right with 40 plus providers and growing like you are. You must be doing something right. And what impressed me was, Ben, you and I met at the Class Patient Experience Symposium, which was held last year in November. And I was fascinated because when you and I had a conversation, you were doing a lot of work to make it easy and convenient for your patients to connect and book an appointment and come and see you. Can you share some of those things that you're doing to make things easy for your patients?
Sure. Thomas Eye Group, about 3 years ago, really embarked on a journey of trying to find the best-in-class online scheduling provider or self-scheduling tool that would integrate with our practice management and EMR system. And through that process, we had a lot of false starts. We had a lot of overpromised and underdelivered software programs that have ultimately landed on a program called Clearwave that was what represented at Class, who has helped us figure out the complexities of eye care. Within our organization, we have probably over a dozen different type of providers just in the eye care space, different specialties, different strategic placements in the Metro Atlanta area in the patient demographic and pathology that we try to service. And so navigating the complexities of those, we'd try programs that would schedule everyone, everywhere, all the time. And that doesn't work for our providers. When you've got the wrong person landing in the wrong provider's chair, you don't get a lot of buy-in from either the patient or the provider that it was a good experience. So we really felt like we had to solve for this. We had to make patient and customer scheduling, customer acquisition easier. And so as we went through multiple iterations of trying to find a self-scheduling tool to enable better patient access and better patient acquisition, we needed to make it easy as possible for our patients to schedule their own appointments and also get in to see our doctors. And so we feel like we've made a lot of strides there. We've led the industry there, and we'll continue to push that as an organization.
And Ben, tell me, why was it so important to Thomas Eye Group to put and make this kind of investment in this capability and on patient experience in general? Is it primarily just because of the competition, or were there other reasons?
Yeah, I think we're uniquely positioned that we're as the largest eye care provider in Metro Atlanta, we have a direct-to-consumer strategy. And our ability to service patients was increasingly dependent on our capacity to schedule those patients for the right appointment at the right time. And ultimately, the patient knows most of what they want and need to get into our organization and see the right provider. And so being able to put a resource and tool in their hands from a patient experience perspective has helped our organization win more patients year over year at a faster rate than I believe anybody in Metro Atlanta is doing.
I kind of, I like the way you put that in a direct consumer model, and especially in your area. Most of the patients, it sounds like, do know what they want. Like they know exactly who they need to see, or what type of doc they need to see, what kind of service they're really requiring. And so now it's just a matter of who can get it to me faster and quickest and easiest, right?
Right.
And so it sounds like by investing and making that as simple, you were capturing more of that market.
Yeah. Well, one of the things that we expected to see new patients adopt it at a higher rate than they have. Ultimately, our existing and established patients are the predominant users of the capability, and that's been a significant win for our patient access team because they're taking less phone calls to schedule appointments for patients because patients are able to self-service. But also, those new patients don't always think about the fact that they need an eye exam on our time schedule. So when we have our patient access team or patient services team, our call center open from 8 to 5 or 8 to 6, that's not always when patients are thinking about scheduling an appointment. And so if we can differentiate ourselves by giving them a Schedule Now feature on Sunday night at 7 p.m., we can win customers in a place and space where our competitors aren't playing.
So you mentioned that a lot of existing patients are the ones who are using it. What's the feedback been from that group?
Yeah, we've been on a multi-year journey to improve our patient experience as an organization, and whether that's being more focused on site of service and having patients receive care at the most appropriate site of service, or deploying technology where we can serve patients or allow patients to self-serve in a manner that they are comfortable with. There's been a very focused effort inside of our organization across our operations, our clinic team, our surgical team, our patient access team to break apart the different processes that our patients have to go through in order to become a customer of Thomas Eye Group, to make sure that we are focusing on the friction that we create for the patient and how we can reduce that at each step in the process. And so patients have been very receptive and outspoken to the changes that we've made. We've taken doctors out of specific locations and put them in more appropriate sites of care where they can deliver a better service to their patients. And ultimately, our customers believe and have told us that that's a better site for them to receive vision care. And as they work through that process and exist and hopefully maintain their relationship with Thomas Eye Group, we hope to continue to hear that feedback, that we are responding to their requests for a better experience at each turn.
I want to pick up on something you said there because that was surprising to me. So it sounds like you took some patient feedback and actually altered where some physicians were practicing. And is that based just on like where the bookings were coming from and where people were wanting to see docs and you didn't have one there and so you moved someone? Is that kind of how it went?
So 4 or 5 years ago, we identified that we had a number of providers within our organization who were delivering excellent care in the wrong environment. And over the course of time, we've built a strategy and a plan to explant those doctors from their existing locations into more appropriate sites of care. And we've seen their reputations, we've seen their patient feedback climb as a result of that. We've seen the financial performance that they deliver as a provider in the organization improve as a result of that change in site of care. And then the patients who were to remain at the existing location have also seen an improvement in their site of care because there's less congestion, less busyness, less people working through our facilities, and more appropriate leveled pathology running through the individual locations that we operate.
Amazing. That is that I love that kind of a story. Just that to me says how responsive you are to your patients. Like you realize that you can provide even better service by changing who you are as opposed to, forcing patients to come to meet you where you are. That's great. So I asked before what the feedback was from existing patients. Has there been any different feedback from new patients? Have you gotten any comments from
Yeah.
people who are new to Thomas Eye Group?
Yep. We have, because of our differentiated strategy, we are seeing that our acquisition rate for new patients and then the retention of those new patients is at an all-time high. So we are highly focused on customer lifetime value. As a lifetime provider of eye care, we want to retain and sustain that relationship with our customers for the entirety of their life and their eye care needs. And so we're getting more positive feedback today related to customer retention, related to customer satisfaction surveys in the new locations that we're building. And ultimately, we believe that that's going to add to our ability to deliver surgical and tertiary care in the future.
Ben, it's exciting to talk to you about this because clearly it's a focus area for you, improving patient experience, being accessible to patients. What new technologies or process changes are you going to be working on next to improve those two areas?
Yeah. So as our organization has grown, I believe that we have to continue to look at our processes and we can't rest on any laurels. So we have a team that's focused on reviewing the processes that we have in place and making sure that we're looking for and identifying and improving areas that need to be adjusted. Obviously, staffing is a significant concern in healthcare operations. And so we're looking into different technologies that can support not only our doctors and our clinical needs, but also our patients, whether it's AR, AI, ML enabled avatars that interact with our patients or scripting that's utilized to help patients self-serve before their appointment and complete a lot of their paperwork in advance. We're looking to create opportunities for patients to receive education in advance of their appointment that will help generate great outcomes for the care that we deliver. And there's a lot of different great technology platforms out there. And as we pilot some of them, I'm excited to see and hear the patient feedback that we receive as a result of the ever-changing technology landscape that is surrounding patient experience, patient education, and the process that healthcare providers put patients through to receive care.
Well, that sounds fantastic, actually. It's always fun to hear stories about patients being able to fill out all their paperwork even before they arrived, and they're not asked to fill it out again on a paper form, right, when they're in the office.
Right.
And then, again, getting the education to know, well, I mean, you're not that kind of a practice, but, hey, am I supposed to eat or drink before I go to the appointment? Am I supposed to bring this or not bring
Right.
that? And, getting all that information
Right.
in their hands just makes all the operations smoother, right?
Yep. We've virtually eliminated paperwork from the time a patient makes an appointment all the way to when they sit in a chair to see a technician or a medical assistant or a doctor in our organization. We've eliminated the paperwork required up to that stage, and we look for and continue to look for opportunities to eliminate some of that waste that healthcare creates, paperwork, faxing, all of those things in between. But ultimately, I believe that you have to do that in a patient-centric way for it to drive value to your organization. So we're focused on where we can deploy technologies that improve our patient experience.
Is there any one tech that's got you really excited, Ben?
I think that ultimately some of the avatar, machine learning, generative AI, conversational AI technology is going to be interesting. I'm a little concerned about patient adoption of that or patient perception of that, but I believe that everybody's aware that healthcare is in an extreme staffing shortage, like almost any other industry at this point in time. And so we're going to have to find different ways to leverage technology to help our patients continue to receive the care they need. We still need the information from them. You still need a health history. You still need medication reconciliations. You still need visual acuity information, but you don't necessarily need a person or multiple people to do that in the process. And I think technology will rapidly enable an integration from a conversation into the EHR. I believe that Scribe technology, like Scribe EMR or Scribe America, will ultimately help propel the efficiency of clinics. Ophthalmology is an extremely resource-dependent clinic because there's a lot of data that's required in ophthalmology. There's a lot of testing that's required in ophthalmology. And so there's a lot of different components within our clinics that I think the rapid evolution of technology will help make more efficient and be a co-pilot to the staff members that we have that are highly skilled and highly trained.
Well, Ben, I have to say, I think you are more than a marketing intern because you used terms like lifetime value, you used patient acquisition, you're talking like a marketer. So I think you deserve a promotion. You're at least a strategist, at least a manager.
Well, thank you. I will pass that along to our marketing team. I don't know that they'll approve the promotion, but I will at least appreciate your support.
Ben, final question for you. Where can people go to learn more about Thomas Eye Group?
Yeah, would love if you would visit our website, thomaseye.com. You can look me up on LinkedIn, Ben Seals. Would love to connect with you there. Ultimately, I'm always interested in meeting different people and having collaborative discussions like we had at class around what you see in different areas of healthcare that I can learn from. Some places call that plagiarism. I call it innovation. But ultimately, that ideation and idea sharing is one of the things that I'm most passionate about and really get a lot of joy out of. So would welcome anyone to reach out and connect that way.
Ben, it has been a pleasure to have you on the program today. Really appreciate all the information you shared with us. Thanks for being here.
Sure. Absolutely. Thank you so much. Glad to be it.
Hey, I really want to thank Ben for coming on camera with me and giving us that amazing perspective on marketing and patient acquisition from a practice point of view. It is not often we get a chance to speak with organizations like his. So I really appreciated the insight and the perspective and sort of that behind the scenes. And I'll just reiterate again, Ben is definitely a marketer. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to Swaay.Health. That's Sway with two A's, .health, where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next episode.